We're going to be talking about dermatologic fungal testing. There's two methods for sample collection. One is going to be our sterile hemostats method, and the other one is going to be our toothbrush method. For the sterile hemostats method, we're going to locate our lesion, use the sterile hemostats to pluck 10 to 20 hairs from around the lesion, and then place those into our appropriate media. An appropriate lesion is going to be one that likes to fluoresce under the Woods lamp, and then when we pluck those hairs and put them in the media, we want to make sure and seep them into the media well, but not submerge them totally. The second method for collection is going to be our toothbrush method. That's going to be where we take a new toothbrush, locate the area that we suspect to be infected, but does not have any lesions, or it looks different than what we would typically expect for our skin infections. We'll brush against the grain of hair growth, right at the base of where the hair grows, up against the skin. We'll brush for 30 seconds, and then we can use that toothbrush to either place just the tips of the bristles into the DTM media, or we can cut off the tips of the toothbrush and place it in, similar to the hair pluck method. To be getting my sample for my DTM culture. We have our patient. She's got some hair loss on the tips of her ears, as well as a small spot in the top of her head. So I'm going to be using my sterile hemostats. I'm going to take a hold of her ear first, and I'm going to pluck like 10 to 20 hairs from this area. So I'm going to get a good hold, pull away. There's the hair. I'm going to place it into my media. Make sure it's placed in there really well, but not totally submerged. I'm going to get a little bit more from this ear. A little more. Place it on this side. All right. And then, going to grab the spot from the top of her head. So there's this little bald spot. So I'm going to get right around the outside of it and pluck. Oh, I know. On that side, there we go. And then I'm gonna get some more for the other side as well. Ooh, this is good girl. All right, this on that side. It's been about 10 days since we started the DTM culture. As you can see, there's only a very small bit of growth right there. I'm going to use some clear cellophane tape to get that sample from the culture itself. So to prepare my slide, I'm going to take a drop of cotton blue stain. Got my dropper, so I'm going to get a small drop of stain, and I can place it directly on my slide. And then I'm going to take that tape and I fold it over just like this, and then I'm going to place it around the growth area, barely sticking it to the growth, all around the sides. All right, so I've got that here, and I'm going to place it directly over my blue stain on my slide. Here we go. Now it can be examined under the microscope. Now I'm going to evaluate my DTM sample slide. I'm going to be looking for trichophyton, as well as Microsporum canis and Microsporum gypsum. So I've got on low level magnification. I'm going to go ahead and raise up my stage, get focused, so that I'm going to evaluate where I place my sample. Okay, based on what I've seen, I will say that this DTM culture result is negative. The The purpose of performing a necropsy is going to be to determine potential cause of death as well as possible disease spread if we're looking for the extent of the disease spread, and for just educational purposes. We're able to collect many samples that could be specifically for the patient and for diagnosing what could have happened, as well as just showing these samples to students, veterinary students and technician students alike, or just for client education. So appropriate PPE for our necropsy is going to be gowns, gloves, and masks. We want to make sure that we don't let any of those fluids kind of get in contact with us. During the necropsy, our doctors are going to pull out samples that we're going to be placing in formalin jars. The formalin jars are going to be labeled with the patient information as well as where the sample has been taken from. Once placed into the jars, we can fill it with formalin, screw the lid on tightly, and then have those for later use. Vaginal cytology is a useful tool in determining the stage of estrus cycle for dogs and cats. This is incredibly helpful when determining whether they're able for mating or when is the optimal time for mating, as well as optimal time for artificial insemination. Cytological findings should also be interpreted in correspondence with the patient's history as well as clinical signs. There are 4 stages to our estrus cycle. The first is going to be anestrus. The second is going to be proestrus, the third is going to be estrus, and our final stage is going to be diestrus or metaestrus. So our first stage of the estrus cycle is going to be anestrus. At this point, our reproductive system is at rest. There could be some vaginal secretions, but most of the time there won't be any present at all. Our cervix is going to be closed, as well as our vaginal mucosa is going to be pale. So if we were to take a swab at this stage of the patient's cycle, we will see intermediate and parabasal cells most dominant on our slide. Some neutrophils can be present, and then it is possible for some red blood cells to be present, but typically there won't be very many at all. No, our patient will not exhibit any sort of clinical or behavioral signs, and while this stage does vary in length, it typically lasts less than 4 to 5 months. Our second stage of the cycle is going to be proestrus. Our patient is going to be experiencing increased levels of estrogen as the follicle develops and the uterus begins to enlarge. The patient can present with a swollen vulva as well as red discharge. So what we're going to see if we take a swab from this patient at this stage is going to be high levels of intermediate, parabasal, and superficial epithelial cells. We're going to see tons of red blood cells and bacteria, as well as some neutrophils. At this point, the patient is going to be attracting males, but will not stand for interaction. This stage can last usually around 9 days, but up to 2 to 3 weeks. Our third stage of the cycle is going to be estrus. This is when our patient is ovulating. She'll be experiencing a decrease in levels of estrogen as well as an increase in levels of progesterone. She'll also have recent history of going through proestrus as well as having that swollen vulva. So if we were to take a sample from this patient during this stage, we're going to notice that all squamous epithelial cells are going to be cornified as well as anuclear. Some neutrophils can be present as well as very few red blood cells. During this stage, the female will actually accept the male attempting to mate. The stage can last anywhere from 4 to 13 days, but typically averages around 9 days. Our fourth stage of the cycle is going to be metaestrus, also known as diestrus. At this point, our patient's vulva will no longer be swollen, as well as any discharge will have decreased, if not stopped at all. The patient will no longer accept any males or stand for them. So if we were to take a swab of the patient during this stage, under the microscope, superficial cells are going to have declined. We're going to see an increase in parabasal as well as intermediate cells, and typically we are going to see a lot of cytologic debris on the slide as well. Diestrus or metaestrus can last 2 to 3 months at a time, and cytologically it is really difficult to tell the difference between diestrus and anestrus. Something that I thought was really interesting is that taking a swab of the patient at this time will look the same as taking it on a pregnant patient, which is really cool. So they're really hard to differentiate cytologically. All right, so we're gonna do our vaginal cytology. Here I have my anesthetized patient. You can see her vital screen right here. What I'm gonna do first is going to clean around her vulva with a dilute Chlorhex solution. I'm just gonna get it really clean. Alright, and then I'm going to wipe that off with some sterile saline. So next I'm going to put on my sterile gloves. And then I've got my sterile swab that I have just opened.
Before, so I have no preference. Just make sure you're fine. Nope. It's just super awkward and it stays well with yeah, just as long as it's not
Alright, so I'm going to grab my sterile swab. And since this is going to be the hand that I use to hold on around the vulva, I'm going to go ahead and contaminate it. Good deal. So this is going to be my sterile saline. I'm going to moisten my swab, how tight, like so. And then I'm going to hold around the vulva. I'm going to insert vertically and then adjust horizontally. I'm going to swab around the inside. There we go. Move around a little bit, and then I'm going to go ahead and remove my swab. And then I'm going to roll my sample onto my slide. Roll across there. And do one more. Microscope slide there. These are my labeled slides, so at this point I'm going to let this dry really well, and then I can stain them. Right, so now I'm going to begin staining my vaginal slides. We're going to use our Diff Quick stain, so I'm going to dip in and out for roughly 10 times. Right, and then I'm going to rinse them. That drain off just a little bit, and then I will do my second slide. And once they've dried off a little bit more, I'll be able to check around under the microscope. Okay, so now I'm going to examine my slide under the microscope. I have my sage lowered all the way, as well as my ocular lens is at 10 times magnification. I'm going to raise up my slide. I'm going to center it over where I had a little bit of an area of interest, which is right there. So I'm going to raise my sage up all the way and get it focused. Visualize everything. Then I can go ahead and increase my magnification to 50 times so that I can get a good look. Alright, so I am seeing what looks like a few intermediate cells, as well as some red blood cells. Alright, so based on what I'm seeing, I think that this patient was in proestrus, so she should be starting to go into her heat cycle pretty soon. Good thing for this patient, she actually came in to get spayed today, so she won't be going into heat anytime soon. For our manual crossmatch for blood transfusion, we can classify it in two ways, either major or minor. A major crossmatch is going to be when we take our recipient serum and add it to our donor's washed red blood cells. And our minor crossmatch is going to be when we take our donor's serum and add it to our recipient's washed red blood cells. When we perform a crossmatch, it's going to be on a patient that we are planning to do a transfusion on. So we're going to see if our two blood types are compatible. Looking at this under the microscope, we're going to look for any form of red blood cell agglutination or hemolysis. For my manual crossmatch, I'm going to take samples from a purple and a red top tube from my patient that is needing the transfusion, as well as a purple and a red top tube from my patient that is donating to the one that needs the transfusion. First, I'm going to let these red tubes clot, which they already have, and then I'm going to spin them down. Now I have my samples loaded. I'm going to go ahead and close my centrifuge. Alright, and then I can hit start. My samples have finished spinning down in my centrifuge, so I'm going to go ahead and get those out. I already have some relabel test tubes here, so I'm going to go ahead and take out my purple and my red top tubes. I'm going to separate the plasma from my purple top tubes and set them aside, as well as separate the serum from my red top tubes and set those aside as well. So I'm going to go ahead and do that. This is going to be my donor plasma, so I'm going to remove that from this tube. Those are separated out, I'll be able to start washing my red blood cells. Now I'm going to wash my recipient's red blood cells as well as my donor's red blood cells. So what I'm going to do is I'm going to take a pipette and draw up some of my remaining red blood cells from my EDTA tube. So I have those, and then I'm going to put 1 to 2 drops in my donor red blood cell tube. Alright. Now I'm going to do the same thing with my recipient's red blood cells from my EDTA tube. Okay, so if I was going to do this entirely manually, I would go ahead and fill up my test tubes almost all the way to the top with some buffered saline, and then I'm going to spin that down at 3,000 RPMs for 1 minute. But because of the facility that I have, we actually have a cell washer, so I'm going to go ahead and use that. It looks like this right here. So I'm going to go ahead and get everything loaded up. So now that I have my tubes loaded into my washer, I'm going to go ahead and select wash, and then I'm going to hit start. So it's going to wash the cells with buffered saline, and once it's done, I'll go ahead and remove it and dump them, and we'll wash this 2 more times. So our first wash cycle is complete. I'm going to open up my washer, take out my samples, dump out my supernatant, set them back in equal to each other again, and then we'll perform our second wash. This is going to be my donor's cells. My recipient cells. Now I can select for our wash for the second time. So my second wash is completed. I'm going to discard my supernatant again, and then I'll perform my third wash. Now that the third wash is complete, I can go ahead and remove my tubes. So as you can see, my supernatant is clear and colorless, so that's exactly what I'm looking for. I'm going to go ahead and decant my supernatant again. Okay, that looks great. Now I'm going to take 50 microliters of my packed red blood cells. I can add those to my donor washed test tube. After that, I'm going to add 0.98 mils of buffered saline. There we go. I'm going to go ahead and set that aside and do that with my recipient cells as well. Those are done, I'll be able to set up my major and minor cross-match, as well as my controls for my recipient and my controls for my donor. Alright, so now that my wash cell solution is set up for a 2% solution, I'm going to go ahead and set up for my major cross-match. So I'm going to take 2 drops of my recipient serum, and add it to my labeled test tube. I'll place the remainder of that back in my tube, and then I'm going to take 2 drops of my donor washed red blood cell solution, I'm going to invert gently, and then I'm going to set that aside. I'm going to do a similar thing for my minor cross-match. I'm going to take 2 drops from my donor serum, add it to my labeled test tube, 2, and then I can take 2 drops of my recipient's washed red blood cell solution, gently, and then set it aside. I'm also going to go ahead and set up controls, so I'm going to take 2 drops of my donor serum and add it to 2 drops of my donor packed and washed red blood cells, as well as 2 drops of my recipient serum and 2 drops of my recipient's washed and packed red blood cells, and set those up in separate tubes. So those will be control 1 and 2. And I'm going to go ahead and do that. converted all 4 of those tubes, and I'm going to set them aside. They're now going to be incubating at room temperature for 30 minutes. Now that my samples have been incubating for 30 minutes, I'm going to put all 4 of them, so my 2 cross matches, my major and my minor, and then my 2 controls for my recipient and my donor, into my centrifuge and centrifuge for 1 minute at 3,400 RPMs. Now that my samples have been centrifuged, I'm going to check for any sort of macroscopic agglutination. That's what I'm going to do. Is I'm going to check my controls first. I have this light in front of me that has a little magnifying glass right here. So I'm going to gently tap them with my finger and see if I notice any agglutination. I don't see anything for sample number 1, which is going to be my donor control. So now I'm going to check my recipient control. I also didn't notice any clumping in my recipient control, so I'm going to go ahead and check my minor crossmatch. I don't observe any clumping in my minor, so I'm going to also check my major, and then once I'm finished with this, I'll go ahead and check them on a microscope slide. So I actually think I might see some form of agglutination in this one. That's going to be my major cross-match, but I'm going to go ahead and put it on my microscope slide and check it. So now I'm going to examine my major cross-match on a microscope slide. So I'm going to take 1 drop from my sample, place it on top of there we go, on top of my microscope slide, and now I can go look at this. So now I have my sample. I'm going to place it on my stage. I'm going to be looking under 10 times magnification. I'm also going to be examining my slide at 40 times magnification. So based on what I've seen, I do think that this sample contains some agglutination, and so I do not believe that these patients are compatible for a blood transfusion.